So we've talked a lot in detail, actually, earlier today, but I want to ask us, before we hear our examples, of what is our overall goal? Well, I think our overall goal is to have healthy, engaged workforces, and you've heard a lot about absenteeism and presenteeism, permitting and encouraging people with chronic conditions to be in the workplace. We want them to work in well-managed organisations. This is Steve's whole agenda around good work. I think if you can achieve those two things, you will have a high-performing, resilient workforce. You're going to have enhanced productivity. And terribly importantly, that will contribute to the stability of our societies. And we will, as individual countries, as well as the European Union, have a better economic performance. So I think that's what all this is about. And what was happening in the United Kingdom that drove them to appoint me and the programme of work that's happened in the United Kingdom was that instead of having an ever-growing, healthier workforce, we in fact had the opposite. We had far too many people leaving the workforce with relatively mild musculoskeletal conditions, stress, anxiety, depression, often a comorbidity of musculoskeletal disorders. And many of those people received no immediate help to keep them in the workplace or to help them get back there. So they were leaving the workplace to go into our benefit system. We have a hugely complicated benefit system. To be precise, 53 benefits that you can apply for in the United Kingdom. And many, many of the people sitting in that system had musculoskeletal conditions that we ought to have been able to deal with had we had a mechanism earlier on. So this is our overall goal. It's interesting, if you look at the 10 top problems that keep people from being most productive in the workplace. So these are the things that impact on our productivity and therefore our economic performance. 6 of those 10 top problems have musculoskeletal components or associations. Fatigue, depression, we know, accompanies many MSDs. Back and neck pain, perhaps I should have even put in sleeping problems, because we know people with musculoskeletal disorders do have problems sleeping at times. Other chronic pain, arthritis, and obesity. And of course, you're often anxious if you're in pain with a musculoskeletal problem. So really, we ought to be able to make the economic case to government. MSDs affect productivity, affect our society, and affect the economy. And then there are other consequences. I didn't know this when I started my job. We haven't talked about it at all today, but we should have it in the back of our minds, that being workless, and many people, most people probably with musculoskeletal disorders have children or have had children. And what we do when we condemn someone with a musculoskeletal disorder not being able to be in the workplace, we really reinforce and perpetuate patterns of poverty and social exclusion. Certainly in our country, child poverty is closely associated with worklessness. So it blights communities and stunts growth. It stunts the next generation and our next generation of workers. And of course, it also really does, it's not an enabler for social justice. It's in fact just the opposite. And we know that children who grow up in workless families have 5 times the level of mental ill health. So this is a family problem as well as an individual problem. We've discussed a few of these things this morning, but I did just want to come back to 1 or 2 of them. Really the one that the fallacy exists that you have to be 100% fit to be in work. I'd like to ask you how many of you go to work every day 100% fit. Well, indeed, very few of us. Very, very few of us. And many people with chronic diseases wish to be in the workplace. They probably don't consider themselves quite 100% fit every day, but they want to be there. but we had a medical certification system that was a binary system. You were either 100% fit, you were 100% unfit. It was a statutory document. It was in law. So our medical practitioners could not say this person has the ability to work if you make these following adjustments, if something can happen. So we've changed that, and we now have a new note. We have our fit note, but it acknowledges that we're not 100% of anything, and certainly not 100% fit. And so we, as a country, needed to change our certification for sickness absence. We also don't teach our healthcare professionals about vocational rehabilitation. In fact, I don't think I was ever taught anything about vocational rehabilitation in my training as a doctor. And yet vocational rehabilitation is fundamental to keeping people in work and helping them get back to work. And although we don't have employers with us today, we can't do any of this without having the employers on board. It's simply and absolutely not possible. They need to understand this journey, and they need to go on the journey with us. So this is rather a complicated slide, but we've talked a lot about early intervention. And if I had to summarize for you what we've been trying to do in the United Kingdom, it would be to say, get rid of the old system of the paper sick note, put it in red because it's dangerous. It's not good advocacy for your patient. Put it into a new system of fit note, which I hope very much will be electronic by the end of the year. We have a nice big lilac funnel with, it says working people's sickness absence, 28 weeks of collecting your medical certificate, you're in our benefit system and you're out of work. And we didn't have a coordinated system to help you get back to work quickly with any occupational health advice, any biopsychosocial interventions. And so the new system we're trialing, but it's a trial, it's a pilot, it's not rolled out across the country. The aim is to get that lilac funnel down to a trickle. It's about keeping people in work and keeping them healthy. And as I said earlier on, musculoskeletal diseases and conditions are really a huge contributor to that wide funnel. And most of that we ought to be able to stop if as nations we had our systems reorganized. So we're now going to hear about countries that have actually done some of these things very well. And I'm just going to leave you with this quote. This was the government's final sentence in its reply to my report to them, in which they very kindly accepted my recommendations. And I think this is what we would all like to create, a society with positive links between work and health, where we all recognize that, and where everyone, whatever your condition, can aspire to a healthy and fulfilling working life, and where any health condition and any disability is not a bar to enjoying the benefits of work. So with that, I think it's Spain first. Is that